Hello, my name's Lyn Simpson. I'm the Chief Executive of North Cumbria Integrated Care NHS Foundation Trust, and I'm really pleased to be sharing with you a 5-minute presentation of an overview of the work that we've been doing here in the organisation during 2020-21. It's quite difficult to fit this into a 5-minute presentation because so much has happened in the last year. However, I will attempt to do that with the key themes. But if there is anything further you would like to know, then please advise us and we can send further information either in the post or via the internet to you. So let's start. 2020-21, we're calling it a year like no other. And I think that's a fair reflection of where we've been. So let me just run through some key things that occurred during the year. In April 2020, we'd actually just entered that first phase of the pandemic. Nationally, everybody was getting to grips with that, and our routine services had been suspended from the 18th of March. So as an organisation, all colleagues were working together to determine how we could best deliver our services to the growing number of patients entering the hospital with COVID. Our COVID response was a massive undertaking across the organisation in every way, mobilising staff, looking after patients, communicating to visitors, etc. It was a really, really big ask of everyone. During this time, we continued to provide urgent and emergency care services, including cancer services, to our patients. In January 2021, we were caring for over 300 patients in our hospitals. That's all of our hospitals here, West Cumberland, the community hospitals. And it's interesting to note that Carlisle at that time was the most affected area outside of London. So there was a great pressure on our staff, our frontline staff delivering the services and our support staff supporting them. Many of the patients we cared for thankfully recovered and are now back in the community going about their daily business. But unfortunately, we did lose some patients, some staff and members of our community, and it was very difficult for us to cope with that. Staff were marvellous, rallying around, supporting each other, and that's going to be a theme as we go through the next year, how we look after each other, how we look after ourselves. So continuing the theme of 2021, a year like no other, what else have we been doing? Well, during the year, we were very lucky to experience huge support from our local community, from the 8 p.m. doorstep clap to donations of several of thousands of pounds for our charity, which we will ensure is put to good use as we move forward. And again, a big thank you to our community for supporting us in that way. Then in December 2020, we had some renewed hope as we were one of the first organisations in the world to deliver the COVID vaccine to patients and staff at West Cumberland Hospital. Again, we had to mobilise our resource to do this. We had to get staff set up and trained to provide the vaccine. We had to set up clinics. We had the support workers providing appointments, but it was a huge success for us. And it has and continues to be having a huge impact on all of us, on our colleagues and the community that we serve. So many people have had their first vaccine, their second vaccine, and now colleagues are receiving their booster vaccine, which is great news. Many of those are having them at the same time as they're having their flu vaccine. For me, there are no words to express the thanks we have for all of our colleagues who gave everything over the last year, working long shifts, staying back, supporting patients, wearing their PPE for many hours a day. You know, that was quite distressing. Then going home worried about whether or not they'll carry anything home to their families. They were first-class staff offering a first-class service to the patients here in Cumbria. We do know that it's taken its toll. And as I said earlier, health and wellbeing is for us now a big focus moving forward, and we'll continue to promote the health and wellbeing of all of our staff in everything that we do. Alongside that, as we move into 21-22, we also want to focus on supporting each other with kindness and respect. Simple words, but mean a lot. If we look after each other, if we treat each other in the way that we'd hope to be treated ourselves, it's a fantastic feeling of well-being. So that's what we'll carry forward. Other things that we started to do during the year is managing our overall activities. So that is patients who need to come in because they're on the waiting list, patients who come through the emergency services, through A&E, and patients who come through outpatients. So we did see the stand down of our activity in order to accommodate the increasing number of COVID patients, which unfortunately resulted in an increased number of patients waiting for planned procedures and appointments. So that's patients who were waiting for hip replacements, knee replacements, eye surgery, the whole gamut of interventional services that we provide. We saw the waiting list volume increase and a number of patients in excess of 52 weeks waiting for treatment. That's not acceptable. All patients deserve timely treatment, and we're now focusing on getting the recovery phase and as many patients through the organisation as we possibly can. We have, I'm pleased to say, reduced our patients who waited over 52 weeks by 45%, but there are still too many, 1,430, waiting to come in, and they deserve the same care as anyone else who's in hospital or coming through a different route. So we'll be focusing on them in the following few months. Many of you will be aware that endoscopy has also been particularly affected. So we're addressing that by bringing on board a mobile endoscopy unit, which will be operational from the Cumberland Infirmary site early next month. And that's going to help us with some of our waiting list issues. At the same time, we're going to be concentrating on our cancer patients who've been waiting for treatment, and they will be prioritised across outpatients, diagnostic and inpatient setting. So our priority for this year is ensure we get as many of our patients requiring elective treatment back through the hospital as quickly as we can. Moving on, these are some of the positive key achievements we've seen, and these are fantastic achievements for the patients and residents of Cumbria. So the first one I want to bring to your attention is the 35 million Cancer Centre, and you recall that we work very closely with our partners from Newcastle upon Tyne Hospital's NHS Trust to deliver this. So this is our building, which we will service, but the care is delivered by the staff from Newcastle Hospitals Trust. It's a great partnership, and it's now open to deal with patients who require treatment locally, avoids them having to travel long distances. A fantastic achievement. We've also continued to develop our approach to delivering more care in local communities closer to home. It's quite important that we have hubs of activity so that patients can see as many professionals as they need without having to travel long journeys. And alongside that, we're doing quite a lot of refurbishment work at both Brampton and Keswick, which of course provides a better environment for patients from where they're having their care and treatment. And finally, just to draw to your attention, we've continued to develop our work with the business case for phase 2 of the West Cumberland Hospital, which has now been submitted to NHS Improvement for approval. We're hoping to hear whether or not we get approval for that early next year, and then it will be rapidly moving ahead to do the necessary works. But again, a great achievement and something I'm sure that our West Cumberland colleagues will look forward to. Continuing our improvement journey, what else have we been doing? So we've seen overall improvements in the time it takes for ambulances to hand over their patients from when they arrive at A&E to the patients being accepted into A&E and being seen by a doctor or a nurse. We've seen overall improvements in clinical oversight of patients in the A&E department. These were things that the CQC said to us that we needed to give some special attention to, and we've been doing that quite successfully. We've seen better processes put in place when we've had a huge volume of patients in the department, that's the A&E department. So how can we streamline, how can we get the patient seen quickly and then move from the A&E department onto a ward or discharged home? And to enable us to do this at pace, we've seen support from some external advisors to help us implement an improvement plan, which is now complete, and we're working to very closely and looking to improvements being made week on week. And one final point I think it's worthy of note is we actually implemented SDEC, which is same-day emergency care, on both sites to help us reduce the amount of pressure on A&E. Both of those areas are moving from strength to strength, and they are providing an improved service to patients. Outside of the clinical areas, what are we doing to improve things for staff and patients in NCIC? Well, we've introduced what we call our NCIC way. It's the way that we do things around here. It's underpinned by our values, and it's the heart of everything that we do. So kindness, respect, collaboration, moving forward in a way that's thoughtful of each other underpins all of our activities. We have made improvements in patient safety, including safeguarding, infection prevention and control, medicines management, and we've been undertaking a mortality review so that we can make improvements, learning lessons from that review. I'm delighted to say we've developed and launched a quality improvement plan, which is really important, particularly for our clinical staff, so they can see the journey that they're on and where we're aiming to get to. And we're ensuring a positive patient experience every time that we interact with a patient, be it on a phone call, when we see them when they arrive at the ward, wherever they come to in the hospital or community, we want to make that a positive experience for each individual patient. And the good news is, on our workforce issues, we've now recruited over 200 international nurses to help improve our staffing position. And the feedback we've had from those international nurses is they've been very welcomed into the organisation, which is important to us as an organisation. So what's the future for us? Well, I think it's mainly around three things. We need to demonstrate that quality and safety are at the heart of everything that we do. And we need to ensure that the patient does have a positive experience every time. If they don't, we need to understand that, learn from that, and put things in place so that we don't make those errors again. Secondly, we need to address our financial deficit, which is, is a large system deficit of over 100 million, by making savings each and every year as we move forward. This year, we are working towards achieving a £10 million saving, and we're doing that mainly through the support services, so not targeting quite as much from clinical services, more from support services, and that will help reduce the burden as we go forward in the following years. And thirdly, by no means least, we're looking to ensure that we can comply with the national regulatory standards. So this is our elective care work, managing the A&E requirements, managing the 52-week waits, eliminating all 104-week waits, making sure our cancer patients get timely information. This is not about targets, this is about patient care and patient safety. So those three things, quality and safety, at the heart of everything we do, including patient experience, addressing our financial deficit, making sure that we deliver our constitutional targets, will be the bedrock of the way that we move forward in the next financial year. So there'll be a full version of the annual report and accounts that can be found on our website, but any general queries that you have, please email us with them and we'll ensure that we address them. And we look forward to working with all of our staff, looking after the health and well-being, all of the clients and the residents of Cumbria, and promoting good services for patients on this, which is our improvement journey. Thank you.